чтобы просто не хочу, чтобы изменилось все. Заряжать, и я буду все крашеное.
Let's see who's gonna be here. Hello, hello. It's office day. Yeah, we're gonna do it live. How you guys doing? Dr. Angelina here. I'm gonna do Morpheus. I did Morpheus on myself 2 weeks ago. My skin is so smooth right now, but the effects of it really takes several weeks to really be seen, but I already can see the difference and I can feel the difference. Now I'm gonna do the Morpheus on someone else. That way we get a proper treatment, because last time I was talking at the same time as doing it to myself. Now I'm gonna do it to somebody else, because everybody always had questions how tolerable it is, what it's for, all that stuff. So I'm just trying to get the machine ready. I'm trying to get my patient ready. Hello, patient.
Hello, everybody. I'm someone else.
So for those who don't know, Irina, if you ever seen me being injected by somebody, she would be the one injecting my face. So she's a very experienced injector. So she does all the fillers and Botoxes and same Morpheus procedures on people. So let me see. Actually, the main menu, make it not so loud. So Morpheus8 microneedling, it's a microneedling procedure where a whole bunch of little needles go through your skin to penetrate it in order to cause injury. So this is an intentional injury to the skin and tissues underneath the skin. And that will stimulate your body to repair that injury. That means it's going to repair the skin with it. So that's how we improve our skin quality. But also in this situation, I'm going to clear my camera. Kind of sort of can see. We're also doing it with radiofrequency, meaning when the needles go in, they will deliver energy. Kind of like if you ever stuck your fingers in a electric socket. I don't recommend it. But the feeling is very similar if you were not numbed. In her case, she'd been on numbing, so she had... I put you down on purpose. Get comfortable. Oh, you're making yourself pretty. Look, you guys. We got a sparkly strap and everything. Just for you. Let me go see if I can put this camera on the other side so that way it's not such a big pain in the butt. So you guys can actually see stuff. Let's position it. Oh, perfect. Ta-da! Can you do that? Can you tolerate that?
Yep.
Let's see. So I can see what you guys are saying. I think I can go like this. There you go. Hello, make sure you give us some likes and stuff so, people join us. Did you wipe off the cream yet?
No.
You have not. Okay, so she had numbing cream, which is a lidocaine mixture type of cream. It's called BLT cream. That's quite strong. For the past, an hour? 40 minutes?
40 minutes.
40 minutes or so. I'm just kind of taking off the cream and wiping her face with alcohol. And again, this is to improve quality of the skin, a little bit of tightening, discoloration, sunspots. All of those things will be improved. You still feel it even after the cream, correct? Depends on the energy. Depends on the energy we'll be delivering. So you might not feel the needles penetrating the skin because numbing medicine took care of it, but you might feel the energy delivery if it's a high level of energy delivery. For this procedure, when I do, let's say on your legs, on the thighs, I do Morpheus8 body, which goes to 8 millimeters in depth. on the thighs, I put you to sleep. I don't bother with this whole numbing cream. It doesn't work. Not at 8mm depth. So, just perчатки. Для красоты. So, have you guys ever, I'm on Manjaro. Hey, good job. How's Manjaro thing going? We can talk about that too. I'm on semaglutide, and that's what most of my patients are on.
And me too.
And her too. Except her we have to baby dose. She gets nauseous like from thought of the medicine. Even Tylenol, so we have to baby dose her. Wait, I'm gonna cycle, multiple. And I'll start with 1mm. Ничего, что красиво. So I'm just gonna start with very superficial kind of. You like my suit? Thank you. I'm going somewhere else in a little bit, and I'll be switching. My current shoes actually don't have my heels on. I have them with me, but I don't have the heels on because I was doing procedure earlier. How's that? This is just 1mm. So that's the machine. You can see where the needles come out through that little hole. This is resurfacing. So this is very superficial needles. This is really to get the very top layer of the dermis to resurface itself. After procedure, she'll feel like a little unevenness. And then after maybe a week, we'll be able to use microdermabrasion scrub to scrub off any kind of those little, they're not really scabs, it just feels like it, like little tiny dots. And once they come off, your skin feels very smooth. Like when I touch my skin right now, I'm still kind of like very, not surprised, but kind of feels really good. Like when you touch your own skin, and it's like, oh wow, this is like smooth. The дергаешься? She's a little bit jumpy, so if the nerve is in the area, it feels like it's kind of like the funny elbow a little bit. Kind of makes you jump without you knowing you're gonna jump. Your under eye still has some cream on it. Just wipe off this stuff.
Settings.
So I'm just kind of wiping your eyes one more time because we want to get close to who's there.
You don't know my walk?
I knew you walk, but I'm on a live, so I'm talking to people at the same time as I'm doing stuff. So I'm just going around. I'm going slower because I'm right around the eye. Really want to get in there. But she's tolerating. Last time she was kind of kicking me.
Yeah.
I'm so excited to watch. Well, I'm glad. I'm sure Irene is super excited having you watch. She likes that. So the pain, in the proper settings, you can get very good results without hurting you too much. Also, if I wanted to go in a super high settings, for whatever reason, let's say you have a condition where I want to go on high setting, I can inject numbing medicine. I can actually inject nerve block like a dentist does. So I routinely do that to my patients. There are many different nerves around our face that I can, inject, and it's called the nerve block, lidocaine nerve block. And that helps with pain because it's kind of like a dentist, once you numb, you might still feel a little jump here and there, like a little nerve when it gets, energy gets near it, but it's very tolerable. And the thing with those nerves, once it zaps you, there's no residual pain, there's no residual discomfort. It's more surprise more than anything. Right, Irina?
Right.
You're not surprised right now?
No, I'm not.
So, and also my patients can get Pronox, the laughing gas as well. So all of that can become very tolerable. Does it get better with each session, like deeper? It gets better, you get used to it, you know what to expect, and so you're not surprised by it anymore. Kind of like waxing. Eye area makes me nervous. Well, yeah, you have to make sure we know what we're doing. My outfit is beautiful, thank you. This procedure called Morpheus8 microneedling. Let me do the side of the face. Let me get the eye. Huh? She's starting to get a little pink. So we adjust the setting based on each patient's needs. Every patient gonna have slightly different requirement, what we're trying to do, why we're doing this. Different color skin will have different settings. You know, darker skin cannot tolerate as much heat on these machines without causing potentially discoloration. So we wanna adjust settings for that. So she's tolerating. Usually she gives me mean looks, and this is just one of those. She jumps a little bit because I'm right near the nerve there, under the eye. So that's just a weird area to start with. Sorry guys, I'll do a little bit and I'll look at the comments because otherwise I get a little, you know, squirrel. While I do this, just tap your screen to give me more likes. She has a little sunspot right here that we always try to laser, so I'm going to stay on this spot and do it multiple times to kind of try to really get it. Hello, hello. So we're doing Morpheus8 microneedling. I don't know if I... And yes, with each session, we usually do go up, like if you tolerate it, like regular session, the first session well, and we know how your overall tolerance for this procedure. The next session, we can definitely bump up the settings if we feel like we need to. Not everybody needs those higher settings. Oh, it keeps timing out. But with this superficial setting, for those who have lighter skin tones, I feel like this is absolutely great for pore sizing. Like I feel like my pores are super small. My skin is so much smoother after I exfoliated it after the treatment. Around the lips is also one of those places where it's kind of like slightly ouchy. Just because nose and lips are always like that, makes you jump. All right, now we're gonna go to 2 millimeters. You want to do more?
Just спинку носа.
You don't have spinky nose здесь, там недостаточно места.
No.
She wants more. She wants more on her nose. Я как бы прижимаю туда. Just gut filler, how long after? You can do it, I mean, it depends where, if you, and who did it, and where you put it, and how deep. If your filler is like on the deeper levels, this does not interfere at all. If you put like filler very superficial, let's say around your eyes, then I have to adjust my settings on how deep I can go with this machine, because it can soften it out a little bit. It can melt it out a little bit. So I'm gonna bump up the energy a little bit too. Wait. Wait.
Yeah.
Just this. She's not liking me right now. Bumped up the energy.
Yeah.
No? Okay, go back down. And just the depth. It's because it's at 2 millimeters. She's running away from me. Who wants to come here and then run away from me? You're so close to me. How do I make consultation? You can just send me a message here on TikTok or Instagram. Breathe. So once we get to the deeper levels and a little higher energy is where she starts getting a little antsy. But I'll just go faster then. I'll stop talking. Okay. There. It's only a little ouchy as I'm doing it. But see, she's not killing me yet. I don't want to get soon. Just a little bit around right here on the cheek. I got your under eye swell a little bit. That's your filler right there. You want to buzz it?
Yeah.
I'll buzz the filler a little bit. I know, it's the funny area. Это на 2 миллиметра не буду делать, только может быть вот это вот сизо.
Да, там хватит.
That filter is making her chin long.
Just my chin.
That's her chin. There's no filter. But the angle maybe. Her chin is perfect. Nose to chin. We do need to make your lip a little bit more, the lower lip. You have to put a little filler here for the proper aesthetic. So when the chin and nose touch like that, that's fine. I want to morphous my whole body. I'll put you to sleep for that. I've done somebody's face, neck, both arms, and both circumferential thighs. I do that under anesthesia. There's absolutely no reason to stay awake for that. You take a little nap, you wake up, you feel like you just been to the beach, feel the sunburn for about a day, and then all of those feelings will go away, and you'll be fine. Good reaction. Breathe.
Yeah.
This is like Kegel exercises on steroids. You've done face and neck. Sounds like a stapler. It's because the way this machine here, they put it on the bigger depth. So you see the needles coming out, kind of, sorta. So this is 4 millimeters. I was doing her at 3 millimeters. Let me do your neck at 3 millimeters under the chin. Yeah. Just your neck. I know, hot. It gets hot, you can feel the heat. How does the pain afterwards? There's no pain afterwards.
No pain.
No, literally, if you feel any discomfort during this procedure, this is literally that one little zap. Like at the moment of the zap. Once the zap is over, there's no discomfort afterwards. And so at home, there's no discomfort. I mean, you will feel like if you touch your skin, it's a little like you can feel stuff was done to it, but there's no pain. It helps with tightening. Yes, it does. Does it feel like a stapler? Somebody said
no,
it
looks
looks like a stapler. I was like, it doesn't feel like a stapler.
It's like little tiny teeny needles. Not much.
But again, we numbed her up, so the needles themselves don't really hurt.
Yeah, it's not needles, it's energy.
It's energy,
Mostly.
yeah. Melasma is a tricky thing. I usually combine it with some treatments with hydroquinone first, and then do resurfacing with this procedure on the low energy and low penetration depth because of the heat. Heat can make melasma worse. Is she numb? Yes, she is. She had numbing cream for about an hour. Most of my patients will carry, most patients will keep the numbing cream for about an hour. And as I said, as needed, I can also inject lidocaine. Are you sisters? No. We have similar accent. Hers is stronger.
Of course. Strong Russian accent.
Strong Russian accent. Between this and CO2, so CO2 is more for resurfacing and also builds in collagen elastin. I do have DECA CO2 laser on in here, and a lot of times I'll combine them. This goes under the skin. CO2 really stays more superficially. I've posted on my Instagram, so if you go into my profile and follow me on my Instagram, Surgicare Arts, yesterday I posted a picture of somebody who had CO2 laser. It was DECA setting, meaning strong CO2 laser setting. To yesterday's picture, she was 2 weeks after her second strong CO2 laser plus some filler. And that's a different case because the lady really, she came in asking for surgical stuff. I'm like, you're absolutely not a candidate for surgical stuff. She's a heavy smoker, cannot do anything surgical. So I was like, let's just do like maintenance stuff. Let's do your skin. Let's do some filler. Hi, Princess Mary Helen. How are you? I'm not done. Get back in here. Glass cool? Let me see. Did I get everything? Okay, lay down. I'll put some lotion on you. She's chickening out. I was like, let me do it. My life is not over. Like we have to keep doing. Oh, you want to? But did you numb them?
Yeah, I can tolerate lips.
You want me to inject your lip?
Just a little bit in the middle.
I can inject her lip. I can inject her lip. Stay by for more lip filler. When do you see result? It takes, I mean, like mine was 2 weeks ago. I already feel the difference on my skin. I see the tightening, I see the pores getting better. But underneath, the progress is going to keep happening for at least another, couple of months. Same with CO2 laser. I usually see final result about 3 months. Doesn't mean you're not going to see a difference right away. You will see difference like within a couple of weeks, but it gets better and better and better. Yeah. And more after 2-3 weeks, yeah.
Collagen production.
Collagen takes time to produce, like your elastin, your production. Like again, we're making holes, we're making injury, your body needs to heal it. So if you had yourself like a paper cut, how long does it take to heal? It's not gonna heal overnight. It's gonna take time for your body to fully seal it off, right? So same thing happens with the little holes we're making. It's gonna take time for your body to fully recover and fully get that result. Make sure you guys tap your screen. Do you have any filler left over on you or no? No filler?
Just a little bit.
I know, which one you want? Velour?
Velour. Usually velour.
Where's the velour? So I guess since we add it, we're gonna do a little bit of filler. So this is Juvederm family, Juvederm Velour, specifically made for lips and nasolabial lines. So it's soft. It's supposed to last up to 18 months if you place enough of it. I also started taking collagen supplement. That's great. That's gonna help you poop. It does help with joint pain, people say. So I don't say no to collagen supplements, but it does not go directly into your skin. That's just not how it works. But it is good for you. You're not gonna hurt anything by taking collagen supplements. So when we talk about fillers, each syringe is 1 cc. And I'm gonna actually put it into another syringe. So I like to put the filler into smaller syringe, like the little Botox syringe, when I do small area like that. She already has fillers in her lips, so we're just trying to touch up one area. She feels like she lost some volume in the bottom. What's the last time you had your filler?
More than 2 years.
Okay. It's been a while.
Mm-hmm. It's been a while. По центру на нижнюю границу.
I got it. Нижняя граница или
Вот
там?
это вот, то есть ее надо развернуть. Вот
Okay.
проекцию.
Now, her lips are not numb, so that's gonna make her cry.
Maybe not.
You want like a leather strap? You sure?
Yes, I'm
You want a
sure.
boob?
No, I don't want
You want something to squeeze?
No, I'm okay.
Not my boob. We have boob
It's true.
squeezies.
It's true.
Stress balls.
Expensive.
We have yeah, squeezing these boobs is a little expensive. Точно.
Да, нормально. Это я могу спокойно.
Oh, hold on. Let me show you. Smile.
Да.
Better.
Чуть-чуть, but
Yeah, well, I just put like tiny bit.
like this.
Okay. Развернуть.
Да, она ушла внутрь. Не надо.
I'm just gonna hold some pressure. I have a little bit left, but I'll stick it somewhere. I'm just holding a little pressure here. Hello, hello. Thank you for all the likes, guys. Make sure to share. I'll probably download this live and make a video out of it to post it for you guys to see afterwards. So again, she has lip fillers for a long time. She felt like her lower lip kind of started to thin out. So I'm just putting a little extra in there. Thank you for the likes. Thank you, thank you. It's hurting me just to see it. How does it not hurt her?
It's not hurt at all. And it's not numbed.
So her face was numb for the Morpheus, but her lip was not
lips,
numb.
no.
I'm using the same syringe you guys use for compounded semaglutide injection. This little tiny. She's brave. Of course she's brave. But yeah, for the patients, I do dental block when I do lips as well. So, actually, look at these. It's better. I'll just finish it up. I'll just finish up right there in the center. That's it.
I can hold.
I'm just holding some pressure. I'm gonna put some lotion on, and then here. That's it. Just pour right here. And that's it for today.
Thank you very much.
Best recovery lotions ever. So we're gonna put that on. You guys seen this before? Excuse me.
You can use my chest.
So I'm using stem cell lotions here. The serum, Baku Kill serum, Baku Kill moisturizer, and epidermal growth factors. I'm mixing it all together. So that mixture right here is what I'm applying to her skin. I feel like I need to do temple filler. Temple filler next. But not today. Not today.
It's still good.
Just a little bit. Oh, it's nice and warm to touch. Oh, hello.
Hi.
Join our live.
Hello, people. You may remember me from my previous work 2 weeks ago.
I have a little bruise. One little tiny thing. Okay, good.
Thank you. Appreciate it.
Запишешь себе тут, напишешь, что надо.
Так это ж не мой, это чистый, мы можем...
Anyways, write it down.
Yeah, no.
Okay, let me get you guys all. Ay, I can't reach you. I'm trying to. Hello. Let's see, what time is it?
It is 3:38.
Oh, perfect timing. I gotta go in 2 minutes. I'm gonna go do some meetings because it's cool. Thank you again for all the likes. Follow me. I do post and do live procedures when I can, when I remember. So I'll be going on a meeting and I'm kind of excited. I'll be seeing one of the ladies I've been following for a long time on Instagram. And I got a chance to meet her a couple weeks ago and she's totally cool. And I'm like, let's do lunch. And she's like, totally. I'm like, well, let's do it. I don't know what's happening up here though. So I'll be going meeting this person. I will see. We get to hang out a little bit, see where it goes. I do random stuff like that. I'm like, let's hang. And she was like, yeah, let's. And I'm like, okay. We're going to go hang. Oh, by the way, look at this. All the stupid bug bites from Miami. That was just stupid. Let's see what's happening in my head. Let's see. I think I need a brush. Get myself meeting ready. This is how it's done. I swear, like, I don't know what to do with this. I don't have a brush. And I have to drive. I have to go to Atlanta. How's that? So anyways, I will post parts of this video later on once I'm able to download it. If you guys have any questions about these procedures, obviously post, text. I do have a video here where me doing me on Morpheus8, and there are other videos here in my Instagram where I get injected with Botox, or I inject somebody with Botox or fillers, or other stuff that we do. So follow and send your comments. I'll see you later.